Black women and children are dying in childbirth, and it's because of implicit bias in healthcare systems and racism, and also the toxic stress that Black women's bodies experience.
Mostly any other country, it's a birthright to have health care, except here.
It transitioned from being the witness to the voice of action when I became a mother. Amari was born in 2013. I got in a car accident, someone hit me when I was around 6.5 months, and it caused damage, and I actually ended up on bed rest for the last 3 months of my pregnancy. It was also a pretty traumatic birth. He was stuck. During the birth experience, I don't talk about it much. I remember the doctor bringing in about 12 students with notepads. While I'm thinking I'm dying and my child is dying, I couldn't even hold him or do my first touch. I was pissed off. All these classes I took, all these things I was supposed to do as a mother, I didn't even get to do that because I was in so much shock from blood loss and all these strange people who were not my family, were not my ethnic group, were no one I knew, and no one had asked me permission. Could there be a class in here right now to watch this traumatic event happening? And as the months went by, and I reflect on that experience, I thought, wow, something has to change.
What was working then is not working now, and it's not gonna work anymore.
The body's a holistic component. So if you're going to address the psychiatric mental health part, you have to look into the medical, physiological, physical part component as well.
So I was diagnosed with sarcoma in 2010. I've been fighting cancer. You know, I had a tumor on my spine that was metastasizing.
I literally passed out at work, and I went to the hospital, and they said you were suffering from this heart condition called tachycardia, where your heart, when you're under an enormous amount of stress, it beats and beats and beats and beats irregularly, and you just pass out.
Those are really big medical problems. Addressing them and helping to treat them before they become too big is a very big project.
One of my great friends, he actually paid for 93 grand for a procedure that I needed. I wouldn't even be here if I just relied on healthcare here.
I don't look injured, but I'm very injured. 55% of my body has been deemed disabled. I have a rod in my leg, one in my spine. I have been on every medication known to man. When I was in college, I had the luxury of writing a paper on cannabis, and that's my first introduction into learning about the details of cannabis and how it helps. And at that point, I noticed, well, it wasn't the cannabis that was wrong, it was the people operating around it.
Here you have people who are actually, number one, qualified, actually qualified to run these systems, and number two, actually deeply involved with the community, making a change positively. What's the point of cannabis being legalized if the people who are most impacted by it can't even benefit at a base level?
They wanted to have control over it, the money that comes from it. There was so much more things to it than just the simple healing properties and the nature of it that it does for you.
I frequently have patients tell me, African American patients, that no one ever told me that my blood pressure was going to lead to this. They aren't offered a lot of times some of the medical screenings or medical care that should be readily available and offered to them.
So we far behind when it comes to mental health care.
While I was in Ghana, we had the opportunity, we were invited to go see a maternal health hospital. We wanted to have a perspective that was something to compare to of what a maternal health hospital might look like that would reduce maladaptive birth outcomes in the Black community when things like systemic racism and implicit bias might not be coming into play. One of the biggest differences for me that I witnessed in the care was the connection to the community. the support that seemed to be buried within the village mentality. So it wasn't as if the mother was just sent to the hospital to go do her prenatal care and then leave. It felt like the village, the family, the hospital was even a part of the village, the church was nearby. That really decreased some of the toxic stress that I think Black women experience.
Honesty and openness is our way back, or our way to mental health, like great mental health across the board for Black people.
As a doctor, it's more so we have to come together as a community and heal. And so if we know that mothers are suffering and going back to work when their body's not healed, what can we do as a community to help that woman? What can we implement and take power in doing to support the families? Because if we don't, like, we just continue to have these issues.
So all of those components go hand in hand. It's not purely their thinking and their thought process and their mental health issue.
What I saw was doctors were listening and engaging in a way that is absent for the American system. It felt very connective, and I think that's the way we should move forward in our healthcare systems.